Welcome and thanks for joining us. My guest today is Rick Bryant, the Healthcare Chief Technical Officer at Veritas. Rick, thanks for being here.
Thanks for having me, Justin.
And so we're now more than 2 years into this, global pandemic that has changed so much about how everything operates, especially healthcare, of course. Cloud-based technologies, of course, existed before the pandemic, but they really became instrumental to a lot of different operations, including, of course, healthcare. What's the takeaway on how cloud services have been used in healthcare during this time?
Well, it's interesting you say that because I've always been a big proponent of cloud development and cloud usage in healthcare, but we're a very risk adverse group, right? Well, flash forward to the pandemic with everybody having to work remotely from home to be able to stop the spread or minimize the spread as much as possible. So we really had to reinvent healthcare overnight. And a lot of that came in the forms of telemedicine, which we've been advocating for years, but we saw more advancements in the past 2 years than I have in the past 10 years. Mostly because the Stafford Act enabled healthcare providers to be reimbursed for telehealth. But consequently, they also had to leverage the cloud for a lot of those telehealth services. And so what we saw is a massive adoption of cloud services within healthcare simply because of telehealth. I have some customers, specifically a big customer on the West Coast, they went from 1,000 telehealth visits a month to over 100,000 telehealth visits a month overnight. Right. And then you couple that with the challenges we had around supply chain. Right. So during the pandemic, you remember we had several surges and several floods. Right. Well, using traditional procurement methodologies, hospitals were not able to get the capacity that they needed. They had to buy the server had to be shipped. Sometimes it was delayed. It could be 2 months before a service can be expanded to provide for that capacity. Well, by adopting the cloud, they saw that they could have that kind of agility overnight. And consequently, because of the pandemic, we're also seeing that healthcare for the first time ever is the largest creator of data in the world out of all industries. And that kind of blows my mind. When you think about the financial services network, right? I probably have 3 to 5 credit card transactions every day. But with the vaccine and the contact tracing and all the details, along with the stuff that was already happening with genomics and personalized medicine, they now create 30% of the world's data. So that becomes a challenge, right? They have to still secure it, but also to be able to leverage that data. And we're seeing how the cloud is improving efficiency, it's improving agility, and it's also allowing them to really harness and capture that data that could change healthcare forever.
And Rick, as a follow-on to that, we're having obviously a big conversation about the extent to which people should return to the office, and I'm sure there are similar conversations happening in the healthcare arena around will some of these changes that we've seen become long lasting? What's your view on that?
Well, I think now that the genie's been out of the bottle, it's going to be really hard to put it back in. Now, specifically, so that's kind of a three-pronged question. I don't address any of these questions just cursorily. So telehealth, for example, I saw the first ever legislation that enabled the permanent reimbursement for telehealth services in the new gun control bill. And it's fantastic, right? Because I think we can all agree collectively as a society that mental health treatment and early engagement is a really strong factor in being able to minimize this kind of impact. But the point being is that that's the first permanent legislation I've seen that allows the reimbursement of it. There still needs to be work done by our agencies and our Congress to enable telehealth throughout all the different modalities and all the different types of services. And I think that's important. We've seen where it can improve the continuity of care, right? We've seen where it can improve accessibility. And we've also seen where it can lower the cost of healthcare. So that's something that I strongly encourage our government agencies to work on because it's going to be quite an improvement. What we saw on the provider side was even more interesting. By being able to leverage telehealth, they can then use automation and they can reduce their documentation burdens considerably, seeing twice as many patients with the same number of resources. That's exactly what's in the intent of the Affordable Care Act, right? How do we improve outcomes and lower cost? So that's something that I do see being permanent, but there's a lot of work out there. Right now, it's just mental health that's able to be reimbursed for under that legislation. The surge capacity and moving to the cloud for SaaS, we've seen a larger adoption of that in healthcare providers and agencies, and I don't see that going back either. In fact, I was lucky to be able to implement the first ever all electronic medical record into a public cloud with an organization in the Northeast. And what we found there is that it was a very difficult lift, right? To move the electronic medical record, we had to move 37 other critical clinical applications that had to be adjacent to it. But once we got it there, we saw real resiliency, right? Not just in a single cloud, but in a multi-cloud environment. And we have tons and tons of other hospitals that are trying to do that. They're trying to move their EMRs into the cloud because at the heart, we really want to focus on healthcare. And with the pandemic, that's another good thing that came out of it, is that I think technologists, which are often seen by the healthcare providers themselves and the clinicians as a cost of doing business, have really stepped up our game and shown how we can facilitate the aspects of healthcare, right? So we've earned that trust. And now that we've earned that trust, I think they're looking for us to continue to accelerate that, to make it easier for them to practice medicine and to better serve their patients.
Got it. Let's talk about costs. Obviously, an important factor in the delivery of things like healthcare. How do you make the use of cloud cost effective? You mentioned that one example. I'm sure you had some experience there, but in general, how do you make the cloud cost effective?
I was just doing another interview with our public relations department, and they cited a Gartner study that said if you move into the cloud haphazardly or not effectively, it can increase your cost by as much as 70%. And I've actually had hands-on experience with that. In fact, when we moved the first clinical system in there, they built out the cloud with such robustness for performance that it was literally five times larger than it needed to be. And it's also important for people to realize that even though we would love to have everything performed within cloud native tools, the cloud native tools aren't at the level of maturity that the other data center tools and enterprise tools that we have. A perfect example of that is if you use data protection within any cloud, all they do is keep snapshots. They don't apply deduplication, which has been a proven methodology for reducing costs. If you leverage the Veritas portfolio, for example, for your data protection, it'll lower your single region data protection costs by 30%. Or if you have a multi-region cloud, it lowers your cost by as much as 60%. Because instead of keeping snapshot after snapshot that keeps charging you month after month, we only keep the snapshots that they need for the duration, and then we compress the remaining snapshots down into 10% of what they were. So to make it cost effective, you do have to look at it from a holistic enterprise solution. And for our customers, specifically in our agencies, is that they've already trusted us for 10, 20, 30 years to protect their data on-prem. That same technology can then be extended into the cloud to help them achieve not only complete visibility across multiple data centers, which reduces the risk for PHI breach or data loss. Also, it improves their cost model considerably. So that's a very important question. Moving to the cloud will improve your agility, but if you do not do it very effectively, it's going to cost you more than what it would cost on-prem.
Got it. And related to that, what are the strengths and weaknesses of the various public cloud platforms out there? There are only really a handful. So,
well, we love all clouds equally at Veritas, right? We support over 60 clouds. Now in healthcare, it's a totally different world because the EMR providers have such control over the standards because they want to ensure performance, right? If you take Epic, for example, they give you a 99.9% uptime guarantee if you follow their architecture. So that architecture needs to be applied into the cloud, which has much looser controls. But when it comes to the clouds, there's really only two that we see very often in healthcare, and that's AWS, which I have worked with them for years, and they actually have what I consider superior performance rating, meaning you can run more complicated and high-performant applications natively within their cloud without having to add other software layers and shims. Microsoft Azure is also coming up there. There's probably 10, 15 total EMR deployments on AWS, and there's about 26 EMR deployments on Azure to date, and that's just growing rapidly. And then the third option is something that's really a bit of, I guess it's more of a political, and GCP or Google Cloud is wanting to play in that healthcare market. The biggest barrier that we have there is that they refuse to not harness and use the metadata. And a lot of healthcare providers and healthcare EMRs find that distasteful, if you will, even though it's not personally identifiable to an individual patient, still harnessing that metadata is something that a lot of people don't. So I guess in my recommendation, and it depends, we've worked with Epic, and they said that 90% of their customer base could work within Azure. 95% could work within AWS, but there's still going to be 5% that they're just such big healthcare systems that they have to run a lot of those systems on premise. So those are the three that we see, quite frankly. within healthcare.
Got it. I mean, that's really interesting. Of course, there are agencies who work to deliver healthcare and who are taking into account those same considerations. And then agencies in general and Congress is looking at the evolving public cloud space and trying to figure out how to manage that in the future. So those are some really interesting considerations. Well, Rick, that's all the time we have today. So I really appreciate you taking the time to speak with us. All right. And again, I'd like to thank today's guest, Rick Bryant at Veritas. I'm your moderator, Justin Doubleday, and you're watching the Cloud Exchange on Federal News Network. Now let me send you back to the studio for more on the Cloud Exchange.